Hello, and thanks for joining us today for a webinar with the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Natea Taylor, and I'll be your host. Our webinar today is on supporting fathers and families in rural communities. We have 5 presenters today who will be discussing the experiences of fathers and providers who serve fathers and families in rural communities. First, we'll hear from Dr. Tova Walsh, who is an associate professor in the Sandra Rosenbaum School of Social Work at the University of Wisconsin-Madison and an IRP affiliate. Next, we'll hear from Kenneth Braswell. He is the Chief Executive Officer of Fathers Incorporated. We'll also hear from Dr. Jeffrey Brown. He is an associate professor of human development and family science at the University of Georgia. Then we'll hear from Dr. Moretta McDonald, who is an affiliate faculty in the Department of Sociology at Virginia Tech and a former National Poverty Fellow. After that, we'll hear from Marcus Williams, a Fathers Involved Now supervisor with the Allegheny Family Network. Thank you all again for being here. This webinar is co-produced with the Wisconsin Child Abuse and Neglect Prevention Board. Please note that the views expressed by our speakers don't necessarily represent the opinions or policies of the Institute for Research on Poverty or any other sponsor, including the University of Wisconsin-Madison. We have an hour today, and after we hear from each of our presenters, we'll spend the last 10 minutes or so at the end for a live Q&A. You can type your questions in the Q&A box. We did get some questions submitted as people registered, so we will be queuing those up as well. Feel free to participate through the chat. We love to know who you are and where you're joining us from. I also want to let you know that we have closed captions enabled, so you can toggle those on and off at the bottom of your screen. And we'll be posting the recording of the webinar within a day or so. So if you register, you'll have a link to those by email. So with that, thank you again for being here, and we'll get started with Professor Walsh.
Thank you all and welcome. I love watching at the start of these webinars, people adding in the chat where they're from. It's great to see folks from around the country and in all different roles joining us, and especially excited to get to have you with us to talk about this important topic, which we haven't covered in this series before. So I'm going to ask maybe Judith or Natea could put in the chat a link. This is the 14th webinar in our series. We've done 2 a year since 2019 on different topics related to supporting fathers and supporting the service providers who work with fathers. And we have an all-star panel here to talk with you about support for rural fathers and families tonight. So we're going to be doing this as a facilitated discussion. We got so many wonderful questions submitted that we are going to do some kind of round robin addressing questions. But first, we're going to start with each of our panelists telling us a little bit about themselves and about the work that they do that directly relates to this topic. So we are going to start with some introductions, and I'll turn to you first, Kenneth, if you would introduce yourself and tell us a little bit about the work that you do.
Sure. Thank you so much for having me. It's a pleasure to talk with all of you, but to address this issue of rural fathers, which often gets kind of lost in the sauce of talking about fatherhood across the country. Again, I am the CEO of Fathers Incorporated. I should also say that I am the director of the National Responsible Fatherhood Clearinghouse, but I am speaking on behalf of my role as CEO of Fathers Incorporated. So if you hear me talking about the clearinghouse, it is from my perspective, not on behalf of the clearinghouse, because I have to include the work that I know and understand in my conversation. And so for me, I began Fathers Incorporated in 2003 in upstate New York, Albany, New York, to be exact. Shout out to Anne-Marie Yates, who I know was on the line. She was my first co-worker when we began doing this work in the state of New York. And when we did this work, we had the pleasure of providing programs across the state of New York to include the depths of New York City and all the way out to Chautauqua County, its most rural area of New York State, including the Buffalo area, Syracuse area, Rochester area as well. And so we spent a lot of time in rural New York doing some of this work. And trying to figure out what were the nuances of providing services for fathers in both rural and urban areas. What we saw, which is what I see across the country now, is that there are stark differences with respect to providing services for fathers in rural areas. And then there's some unique nuances where you'll see similarities no matter where you serve fathers, and that's child support, that's employment, that's parenting classes, domestic violence prevention, all of those things you will see no matter where you serve fathers. But the nuances that we encountered when we were in rural areas were things that spoke more to like transportation. How do fathers get to the resources if they are available in proximity to where they're living? And so within our work with Fathers Incorporated, in addition to that background, we also now run one of the OFA's fire grants in Metro Atlanta. And while Metro Atlanta may look a particular way from Metro Atlanta, we also serve fathers on the outskirts of Metro Atlanta in more rural areas. And we see similarities with respect to all rural areas, which is the distance between resources and services, distance between them and jobs, difference between them and medical assistance, all kinds of researches that they desperately need help in. You're going to find those kinds of things in those rural areas. And then in the work with the NRFC, just last year, we did some work in West Virginia, where we went there to really look at how West Virginia was applying TANF funds to be able to serve fathers through their home visiting programs and other programs. And in those conversations with them, we heard some of the same unique nuances with respect to serving fathers, which included transportation, but also included a couple of other things that tend to pop up more distinctly when you're talking about rural fathers. And I'll close here. But it's important to note because it is something that we have to take a closer look at, and it is the devastating impact of opioid abuse in rural areas and how we are serving fathers at the same time that they are struggling with finding adequate wage earning jobs, having a proximity to resources, and even having organizations around them that actually has an expertise in working with fathers, because that's a nuance in and of itself in social services. And then there is the vagueness or looseness of resources in those areas that understand not only what these fathers need to be the best fathers that they desire to be, because that is the similarity across all fathers. They all have a desire to want to be involved in the lives of their children in a healthy way, but they all need help in one way or another. And so that's my backdrop. That's some of what I've done, and I'll talk more in depth about those three things as we move along today. Thank you.
Thank you so much, Kenneth. Moretta, would you introduce yourself next, please?
Sure. Hello, everyone. I'm Moretta McDonald. I'm a former IRP National Poverty Fellow. So this is like homecoming. So I'm a sociologist and I earned my PhD at LSU. And my world of research exists at this intersection of race and gender and family and criminology and public policy, right? And this intersection drove me to study child support policy and fatherhood, right? But actually, maybe child support and fatherhood drove me to that intersection. My work really started outside of the academy as a child support worker who enforced child support orders in both rural and urban areas. And I noticed the differences in operations, behaviors, and resources, right? So this fueled my intellectual curiosity to examine place-based differences, right, and outcomes, including child support engagement across the life course of parents' engagement with child support. Plus, in the public imaginary of the enforcement side of child support, right, fathers are the parent in the forefront of people's minds, right? So in addition to work that I do on child support, I also write about fathers more broadly, particularly Black fathers, but always with social policy being a thread in this narrative that I'm weaving, right? It always comes back to policy. So in my dissertation and forthcoming research, I examined county level differences in a number of child support outcomes that predominantly impact fathers, right? Taking into account differences across rural and urban divides, like differences in resources, as Kenneth said. And this was a state level analysis. During my fellowship, I was afforded the opportunity to examine these trends at a national level, and also understand the national policy context, which brought a slightly different view on the way rurality impacts fathers and the families within the child support space. And all of this shows us that one size fits all policies don't work the way, especially when they're constructed from an urban bias, right? And one thing I also wanted to point out about my research, especially at the state level, is that the findings that emerged through my research are not ones that usually are reflected in individual level analyses, right? Some of the racial differences and differences based on employment are not ones that are usually reflected when you look at comparing individuals. But at the aggregate, we can see patterns that may be office level patterns, they may be judicial level decision-making patterns, but they actually impact the lives that fathers live day to day, right? So when we talk about people, universally, we all have similar needs, but the resources are what's different often in these rural and urban spaces. So I'm just really excited to be on this panel, and I hope that our audience learns some and I can support the work of my fellow panelists.
Thank you so much. Marcus, could you introduce yourself, please?
Good morning, good afternoon, everyone. I'm saying good morning somewhere. All right. I'm Marcus Williams. I am the Fathers Involved Now supervisor at Allegheny Family Network. We're located in Pittsburgh, Pennsylvania, Allegheny County, to be specific. What got me into this work? I grew up in a single mother home, so didn't have father there. That's kind of what brought me to this role. I was a former corrections officer, so I seen it on that side of it. Being, fathers being incarcerated and not being able to, help at home. Being present, but through the phone. So basically, that's why I'm in this role. I run a program of there's 6 staff underneath me. We work mainly, we're federally funded, CYF, Children, Youth, and Families. That's where we get most of our referrals from. To work at Allegheny Family Network, we have to be a family member, and what we call a family member here would be, everybody here has to have a child or have raised a child with mental or behavioral concerns. So that's what makes us unique, within our community or our area. So today I wanted to talk a little bit about supporting fathers in the rural communities, Allegheny County, and how that looks, and what we do here at Allegheny Family Network to support the fathers. So a little bit, one thing that we see a lot is limited resources, limited services, like childcare, mental health support, employment programs, economic hardships, jobs, job opportunities are scarce out here, like, with transportation and, resources to transportation, rural areas, the public transportation doesn't really run so many places, that's one of the barriers that the guys here are having, and we work a big deal with, a lot of fathers that have transportation issues. One other thing we do, the social interaction in rural areas may lack supportive system, leading to increased stress and mental health changes. So, let's see what else. Why supporting fathers matters. Strong when fathers are in the family, they receive more engagement in the child's lives, leading to better outcomes in the entire family. Healthier communities, providing fathers with resources helps poverty, crime, and substance abuse. Kind of like what Mr. Braswell said. And another thing, supporting fathers does is breaking the cycle. One thing that that a lot of fathers, I can't say don't realize, but is what you grow up in is what you don't. That's not the end game. So breaking the cycle is big, and we help fathers daily, and supporting them to break that cycle. Sorry about that. I'm looking at my PowerPoint and it went off. So one thing that we do a lot with community local churches, mentor programs, barbershops. We do a lot of fathers events, going, Pirate games, Steeler games, Disney on Ice, a lot of stuff that we do with the fathers here. So it's stuff that, that somebody, a father wouldn't be able to do financially, that we help provide them with. So just, with that being said, supporting fathers in, rural isn't about just them. It's about strengthening families and communities as a whole. And with the right resources and community engagement, we make a meaningful difference in their lives. So,
Thank you so much.
thank you.
And so you can kind of see our panel has a breadth of practice, wisdom, and research expertise and national training, all kinds of experience here, founding organizations and so on. I'm going to ask our last panelist to introduce himself, please, Dr. Jeffrey Brown.
Thanks, Tova. Really happy to be a part of this group, and really great set of panelists. I appreciate the invitation. Yeah, my name is Jeffrey Brown, and I'm an associate professor at the University of Georgia in the Department of Human Development and Family Science. So I'm a fatherhood researcher. I'm trained as a developmental psychologist, and let's say a few words about how I kind of got into this, and then a few things that were sort of starting to learn about rural fathers in particular. So my entry into this area was as a researcher and as a scholar, and it didn't take me long as a student to recognize that there's a lot of research about parenting in my discipline, but historically almost all of it was based on research with mothers exclusively. So I always wanted to understand more about families and child development, and it struck me as odd that there was this entire person that really wasn't represented in the research, and didn't really seem to matter, and that wasn't consistent with my experience, and it didn't seem to be consistent with the experiences of most of the families we were studying either. And then as I got further along, we've seen a lot more interest in fathers, and it's been gratifying to see us as a field learn so much more about fathers and include fathers more. But also I think that there still are clearly some populations of fathers and of parents that are still not very visible. And so the work I've been doing, with my colleagues and graduate students and collaborators at the Center for Family Research at UGA in particular, we've been interested in studying fathers who have been marginalized a bit more, either societally and marginalized from the research process. So for me, a lot of this work has been focused on studying young Black fathers in rural areas without a lot of financial resources, and especially unmarried fathers too. And as we start to study these families, obviously, other people I'm sure have had the same experience, but this is a very highly stereotyped and stigmatized population of fathers in all kinds of ways. And what we found, and what other people have found in their research too, is that these stereotypes and stigmas are completely untrue. The rural fathers we're studying are doing so much for their kids, and they're incredibly motivated to be involved in their children's lives, even when they face a lot of contextual stress. So the story that's being told about these men is harmful and inaccurate, I think. So that bothered me as somebody who cares about fairness and justice, but also it bothers me as a scientist a little bit too. Right? So one of the things we're trying to do with our research is to allow these men's voices as parents to be heard for the first time in some cases, so that we can understand more about their lived experiences and their parenting experiences, and then understand what we can all do to best support them. So I can give one quick example, if you'll allow me to, about, and this is all sort of work in progress. Some of the stuff is rather new, but but what we're really trying to do with my research program is to try to understand what are the barriers that make it challenging for fathers to engage with their children in the first few years of life, and then what are the supports that allow them to overcome some of those barriers. So there's a couple things that we find that are kind of consistent across all fathers and across multiple studies, and they're things that people who are listening to this might expect. Your relationship with your own father and the family of origin is a very strong predictor. So, whether if you had a father that you were close to and had a close nurturing relationship with growing up, that makes it more likely that you'll be engaged with your own kid. The quality of the co-parenting relationship with the child's mother is very important. Again, not the romantic relationship. In fact, many of the men that we're studying are not married. And we're never in romantic relationships with the child's mother. And for them, actually, the ability to work together and collaborate and communicate around child-related issues is even more important than couples that are in long-term married or cohabiting relationships. So those are things that we find for all fathers, really, and we find those for our rural fathers as well. The one new thing that we've been doing with some of our studies of rural fathers that I thought folks might find interesting, or at least I find interesting, is we've been looking at the social networks that these men are a part of. So we ask them, who are the important people in your life? Who are the people that you have contact with, that you rely on for support, that you talk to a lot, and then we ask them about those people in their lives, and then we also ask them about how well those people know each other as well. So how well does everybody else in your network know each other? And one of the things that we're finding, I think, is very interesting, that does seem to be kind of unique to these rural fathers that we're studying relative to other groups, is that even though they live in areas that are less dense in terms of where people live, their social networks are incredibly dense, right? So many of these men are saying they have very close relationships with lots of different people, and those people all know each other very, very well. And so those social networks, so that's a very interesting phenomenon that we're seeing that seems to be specific to our rural fathers that we're trying to learn more about. It seems to be protective in some ways. So for example, fathers that have some depressive symptoms after the birth of a child, which many of our fathers do, it's helpful if you can have that really tight network to help to facilitate support for you. On the other hand, there's other situations when we look at our fathers about who are preparing for the birth of a new child and how ready they feel for the birth of a new child. There's two things that tend to help them in their social network. One is having more exposure to other fathers, so having more fathers that are part of your social network, and the other is actually having a network that's more loose and less dense, where not everybody knows each other really, really well. And so the idea there is that those men, we think, are connecting with people from different parts of their life that might be bringing in different ideas about parenting, different experiences, access to different resources, sharing different types of information. So maybe somebody from, who's an extended family member, somebody from work, somebody from church, somebody from other places. And those types of social networks, when preparing for the birth of a new child, seem to actually be the most helpful. So anyway, I think that I'll stop there. But one of the things that I think we're learning from this is that those things that can really help us, that seem to be really helpful and impactful for allowing men to stay engaged with their babies are things we can do through programming, right? You can, and in fact, that's what fatherhood services and fatherhood programs often do, is they bring together fathers to have time and space with other fathers, and they can potentially help connect them to other people who might not otherwise be a part of their social network, right? So, so we're feeling very, very hopeful about what we're learning specifically about those social networks in rural contexts, and hopefully there's some information there that's going to be applicable to the services that we're able to provide for those men. So, much more I could say, but I'll stop there and want to hear from other folks too.
Thank you so much to all of you for introducing yourselves and your work. So in everything that you mentioned, I heard a lot of the topics that kind of motivated this webinar were, when we'll talk in previous sessions about various supports for fathers, we'll get comments or questions about, well, I'm in a rural area where we face these barriers, transportation, as several of you named, longer distances to connect with services or get healthcare, or to find a job that it's difficult to get there. There's not a lot close to home. Would love to kind of move into hearing some takeaways from each of you from your work that might be kind of actionable and useful for folks who are on the line from all around the country, as we're seeing in the chat, doing work directly with dads. If we're talking, if you think about folks who do work to support fathers in rural areas, any kind of key findings from your research or key takeaways from your experience working directly with fathers and working with organizations that serve fathers about ways to expand support for fathers in rural areas and to kind of support the folks who do the work with fathers in rural communities. I'm going to turn to you, Mr. Braswell, to start us off.
Okay, I'm going to take a conceptual shift because oftentimes when we're talking about rural fathers, we tend to lean on the barriers specifically that impact the fathers themselves. But we don't talk enough about the barriers that are impacting the service providers, because oftentimes the impact that service providers are having as a result of also being rural is a factor in being able to deliver services. And so it's important to understand from that perspective the necessity of multi-sector partnerships, right? Because these dads are coming to you with all kinds of issues, right? They're coming to you with workforce issues, mental health issues, legal aid issues. They're looking for many types of things. And so it's important that you become the leader in your community in connecting the dots for them so that they don't have to search for other agencies that are also father friendly and that can provide a piece of the service that then add to the more comprehensive need that fathers have. And so it's important in urban areas, but it's even more important in rural areas, because just as you are out of proximity to their immediate touch, so too are other resources in the community that they may not even know about. The second thing is we learned a lot with COVID. And I think COVID forced us to rely on, in many instances, and then leverage in others, technology. And we got to begin to start figuring out our communication mechanisms between our agencies and our fathers. One of the areas that I'm beginning to look a little deeper in that is emerging in the space is telehealth. And I'm only experiencing that because I'm experiencing it personally, where I don't even see my doctor anymore. I'm talking to him online through the portal, and he's giving me information, and my prescriptions are happening, and he's referring me. And so those kinds of things eliminate the physical spacing between you and these fathers. And so where you are looking at your agencies, how can you look at technology, and how can you look at social media, right? That is also critically important, because that's where these dads are communicating each and every day through their phones. And so you have to figure out more technological ways to get connected to your dads. And then lastly, sustainability. There is nothing more unnerving for a father to need a service and the service is not available because the entity is not available. our work is about, and it's what we lean on at Fathers Incorporated, is that we need to be available when people most need us. We can't fail or fall when people most need us. And so the ongoing work, not only of the direct service, but the sustainability of your programs and your advocacy and your relationships and your funding, and having conversations with your federal folks and your state folks and your county folks and the philanthropic community and your corporate folks, and always looking for innovative ways to ensure that they are supporting the sustainability of your organizations, and that you are looking at long-term program sustainability and not short-term sustainability. And so if I can leave anything with you in rural areas, those are the three things that I think can work the quickest in helping you at least be available for fathers when they need you the most.
Thank you so much. And lots to think about there, and for us to come back to thinking about the opportunities with technology and, like you're saying, sustainability and how key that is, that people need to know that you'll be there when they need the most. Such important thoughts. Dr. McDonald, I saw you nodding along, so I'm going to turn to you next to hear some takeaways from your work, or if you want to build on what you've just heard.
I'm going to build on it a little bit and then talk on my work. So especially the technology piece that Kenneth just discussed, they are, rural areas also have the infrastructure there is not as good as in urban areas, right? And we found during COVID, not me, but research found, that during COVID, lack of internet connectivity was a huge problem in those areas as far as getting resources when everything went online in rural areas. The newest connectivity hadn't been brought out to those areas. It was very spotty with towers. And so our rural communities were really at a disadvantage during those times. I think more since then, I've seen that a lot of more work has been gone into bolstering those types of services. And so I'm hoping that as we start to rely more on the technology, that will be more helpful for our more socially isolated fathers in rural areas, that state and local and federal resources are also put behind improving these resources that help whole families, school children, and things like that. So that was one thing. And one of the things that I also saw in my work in the difference in rural areas, especially looking at things from the policy side and more structurally, right? And it's always their availability and quality of these resources that we talked about, right? Even though the needs are the same across both populations, whether you live in a rural area or whether you live in a urban area, you still need food, clothes, water, sleep, housing, relationships, health care, employment, right? But in studying resources, especially in the Deep South, where my study was done, and at the individual level, I hope to find out if if Jeffries also, talks about this, is that I found that rural areas, they have experienced deep disinvestments since like the 1950s, really. And they often only have one major industry as a source of employment, right? And which it not only constricts job availability, but it reduces competition, which reduces the ability to earn a higher wage, right? So then the population is often less educated because of brain drain from in rural areas related to low return of education, that's related to industry specialization, that's related to disinvestment, right? And then if you don't have the workforce with the skills to attract new industries, then it's further disinvestment that continues this cycle on and on, right? Then we talk about the low density of population in rural areas, which often is an explanation for not housing more research source hubs within a county, which leads us to counties with one place in a county seat, most likely, right? And based on father's proximity, there's a lack of public transportation. Fathers may not be able to access the few resources that allow their inclusion, because a lot of public policy doesn't even allow fathers who don't have children in their homes to access these resources, right? And so then there's job training and job programs that are often offered to fathers, which is one of the few, but they have very limited effect when there's few jobs in your community. And where there are jobs, if you lack reliable transportation to get there, and then there's lower wages, so all of these issues compound. And especially when we are thinking about fathers only in this realm of breadwinner and provider, right? And which is the way they're proceeds when we think about child support policy, right? So all of these things that are compounded in the rural areas make it more difficult for low-income fathers to make ends meet, and then to have those ends extend to paying their child support. But as Jeffrey said, they have vast networks in rural areas, and so they often have family support, which meets needs of their children outside of this expectation of child support, right? Which is not often given credit in that system, right? But they also are they're viewed in a different light and with less resources. And my research also reflected, though, that child support burden in these rural areas are actually heavier than in urban areas. So whether this is a factor of community because everyone knows everyone, and maybe judges are harsher, or maybe because the mother may know someone and things are harsher, or the community mindset of individualism and self-sufficiency may also factor in all of that. But these tight communities also mean that parents, aunts, uncles, and sisters are also helping pay child support, who often still have low income. So the entire family and community is impacted by this larger burden of child support in these communities. So our rural communities who have the same needs and often live in a different structural reality than many of us that live in urban areas, with all of the same structural issues to deal with.
Thank you so much. I'm going to turn to you next, Jeffrey.
Thanks, Toa. Yeah, I mean, so much I could talk about it. I'm gonna, veer a little away from what I was thinking about talking about, but which is always a little dangerous. But and just build on what the last two speakers had to say, actually. So
feel free to pivot also if there is something you want to add.
Yeah, no, I think that both were making just super important points, and to some extent I want to echo what they have to say and maybe just add to it a little bit. But yeah, I mean, when we look at, again, thinking about the things that might be sort of specific to the rural fathers that we're studying, that many people are serving out there who are part of this call. Yeah, Dr. McDonald is absolutely right. I mean, that a lot of it, the economic circumstances are certainly one of the things that are different, and the structure of a lot of the rural communities in the South, in the rural South in particular. These are oftentimes communities where there are insufficient educational employment opportunities for young men in particular. In many cases, there's a history of discriminatory hiring practices, which make things worse for racial and ethnic minorities, of course, and are at least partially responsible for keeping families in generational poverty. We also see that in our rural samples that the fathers there are more likely to become fathers at an earlier age than the men we've studied in urban areas, generally speaking. So they're having kids very young at a time when they're also struggling to make ends meet, trying to get education, job training, all those sorts of things in an environment where there's not enough of that, or there's not enough high quality opportunities for them. So what we find is that they actually are reporting, again, relative to what we see in other more urban or suburban populations, much more financial distress. It doesn't necessarily always mean that they have less money objectively, but they feel like they have more stress and uncertainty about their livelihoods. I think some of that has to do with limited number of industries, limited number of educational opportunities, worried, of course, about how they're going to support their kids, where the next paycheck is going to come from, and there's really a sense that there's very little margin for error in terms of getting by economically. So that's one thing that we really have found that can take a toll on a lot of men. We find that it takes a toll in lots of ways, psychologically and biologically, in terms of their own health and their ability to meet the needs of their kids. The other thing I want to just mention really quickly as a structural issue is what Kenneth brought up as well, which is the healthcare system. I mean, there are struggles with the rural. The healthcare system in this country has many problems in many places, but rural healthcare in particular is, tends to be more underfunded, and there's problems accessing healthcare, and we see very clearly from this the health disparities that we see in these rural environments are bigger, generally speaking, than we see in most urban environments. For example, the pregnant women that we've been studying, most of them, almost all of them actually really are not receiving their prenatal care in hospitals, but through public health clinics, which are doing a ton of great work in so many ways. But broadly speaking, they tend to be taxed in terms of short staff and lots of turnover and lack of resources and those sorts of things. So my point about one more quick thing I want to say about that we have really learned from a lot of our studies is the importance of men. Men begin the process of becoming parents even before the child is born. And there's lots of data, from us and from many other people to support this, right? And that's psychological preparations and financial preparations, but it's also things like attending prenatal visits, listening to your child, being there for your child's ultrasound, being part of the labor and delivery process, those sorts of things. And so there are lots of reasons to believe that to reduce disparities in child health and development, as well as to reduce disparities amongst parents themselves, we really need to get fathers. I would argue there need to be more programs out there that are getting fathers involved prenatally, and ideally that would be through the healthcare system, through prenatal visits and things of that nature. I really think a lot of the data suggests that we get the most bang for our buck in terms of, so to speak, in terms of those types of interventions and preventive interventions. And yet you can imagine what we hear from our fathers, particularly from our Black fathers, and particularly from our unmarried fathers, that they are oftentimes cut out from that process. I mean, especially during the peak of COVID, as other people have mentioned too, but even still, at best, they're sort of begrudgingly welcomed into that process in most healthcare settings, and at worst, they're sort of intentionally kept away. And we see from our data, and we hear from both mothers and the fathers that they're almost always super motivated to be involved and engaged with their children and to stay engaged. And we hear from both parents that sometimes after the baby's born, it's too late, right? Because things happen in their lives and in their contexts and their relationships that that can make it easier for them to withdraw and disengage, or necessary for them to. So anyway, so there's a real problem. And again, I think that's nationwide, right? Thinking about the ways in which we can get men involved prenatally. But the struggles are exacerbated in rural areas because of the strain on rural healthcare systems. So I really think there's a lot of innovative work potentially out there that we could be doing to think about ways to engage fathers in that process that would really help to reduce some of those big disparities that we see in rural areas in particular.
Thank you. And before I turn to you, Marcus, I'm just going to encourage people to take a look at the chat if you haven't. Our presenters have been adding some great resources, and folks are adding comments and questions that are really thoughtful. So take a look if you haven't yet. Marcus, I'm going to ask you for some takeaways from your work. And if you would, I'm wondering if you could also maybe comment or connect a little bit with what Kenneth shared, how you see multi-sector partnerships happening in Allegheny County. Are you bringing technology into your work? How you think about sustainability? I would just love to hear. We've got folks who have perspectives on different parts of the country. How do things look in Allegheny County in those areas?
So in Allegheny County, we're definitely, we use a lot of telehealth. It's technology, it's phones, everything, kind of like Kenneth and Jeffrey said. Telehealth is so common, it's ridiculous today. But we use a lot of it. Parents, fathers work, fathers got school, got you name it. They got sporting events that that they have to attend daily. With being a single father, it's you can't be at two places at one time, and it's a lot. So we use a lot of telehealth, text messaging, just giving supports and resources through text messaging, video call, Zoom call, in person. We run support groups where the support groups a hybrid, where we have a in person where they come to our facility here in downtown Pittsburgh, or we have a Zoom link that we send out monthly, and they can attend via Zoom as well. So we definitely use a lot of technology here. But one thing that I'm really going to touch on here today is how we outreach strategies for to engage fathers. Some of the stuff that we kind of don't, I guess you don't really get too much in urban areas. But I guess like you could say you do, but you don't. So we kind of try to build. I talked about this earlier about building partnerships with churches and barbershops and community centers. That's one thing that we kind of lean a lot on. With everybody, church and barbershops. That's places where fathers go constantly. So we kind of lean on that a little bit. One other thing we use is, like I just got done saying, is social media, Facebook, Instagram, Twitter, Snapchat, you name it. We use it. If whatever way of communication we have with the father, that's what we could do. And then sometimes we take it back to, old fashioned. We post stuff in gas stations, flyers, paper form. It's some fathers are a little bit older. We serve different fathers from all different ages. We got 18 the whole ways up to I have a foster father that's 71 years old. So it's all about their learning styles and technology and stuff. I touched on this a little bit earlier about the virtual Zoom and phone calls. We do that. A couple other things we do. We host sporting events. Like I touched on a little bit earlier, pirate games, Disney on Ice. We did a cookout. We did actually a cookout where we invited all of families, and we bust them. We bust them with, we had four different locations you could go to if you could get to that location, and we bust them from there. Some our family support partners went out and got the families and their child, and we had bounce houses, we had petting zoo, we had it was a great event, stuff like that. That, like I kind of said before, that the kids might not be able to attend without the help of our agency and our great support partners we have here. Another thing, ensure that we have child-friendly spaces. Like when we have our fathers groups here, we childcare. Like we have childcare from that 6 to 7:30, that 2 hours, hour and a half, 2 hours that we meet. We have we provide childcare. We have a family room with where the kids building blocks, PlayStation, YouTube, all the stuff, food, all the stuff we have. Another thing we do, we collaborate with local employers, like everybody here, we have an employment specialist that connects directly with certain places where, hey, dad would be a good fit for this, or dad would be a good fit for that. So we try to pair the dads with the, even educational, level. Another thing we do provide, I think Miss McDonald talked about, the education, like some dads enroll, they drop out of high school at a young age, or, they become young fathers at 16, 17, 18 years old, and they have to drop out. One thing we provide here is we provide GED classes free to everybody. We get them, it could be virtual or it could be in person as well. It's Tuesdays and Thursdays, so which we provide transportation for that as well. If their learning style, they need to come in person, we do that.
Thank you. These are some really excellent examples, and I think there are, some questions that folks are asking about kind of how to get started. And so I think it'll be really helpful to hear about some of the excellent programming you're doing. Our hour is kind of flying by here, and I want to pull in a couple questions. And as I do that, I'm just going to encourage our panelists, if you are comfortable with folks following up with you with questions, a couple of people have asked, feel free to put contact info in there if you would like people to reach out to you with questions. So there have been a couple of questions that have come in here that are about, funding and what's likely to be available. I think I want to just ask that slightly differently and kind of ask you, Kenneth, if you would expand a little bit on when you think about sustainability, how you approach it. You named lots of different partners that, and kind of funding streams, but how do you think about keeping the work at Fathers Incorporated going over the long term, which might be helpful to others to hear?
Sure. As of today, my understanding is that they are still moving forward to release those grants, not only the FIRE grant for fatherhood, but the Reframe grant for relationships and marriage, and the Ready for Life, I believe which is the youth grant. And so as of today, I can't speak for tomorrow, but as of today, the plan is still for those to move forward. So the good thing to do is to go on to grants.gov and sign in for the updates. And so if you go into grants.gov and sign in for the updates, as the timing moves and all those things, you'll be notified, when those things are going to drop. For Fathers Incorporated, it is looking at grants and looking at relationships with the philanthropic community and corporate community. We struggle, just to keep it real with you, with individual donations. People just have a hard time finding a soft spot in their heart to donate. Now, I've seen some people do it very well. I've seen the folks in St. Louis, they do an awesome job with getting the community involved with supporting the work that they're doing with dads there. And I've seen some others, but for the most part, most people struggle with individual donations, and that's not an indictment with respect to you shouldn't try it. You should definitely try it. Your network might be different from mine. And so when you may have supportive people to be able to do that. The other thing is not always looking for fatherhood in the title of a grant, right? And so those are far and few in between. And so if a grant comes out and it is about something around parent engagement and education, you apply for it, but your cohort that you're trying to work with is fathers. If it's workforce development, apply for it, but you're applying for it for fathers. If it's mental health, apply for it, but you're applying for it for fathers. So don't get locked into always looking for a specific fatherhood grant. Any social service grant applies to fathers. You just have to find that niche, justify that niche, and apply in that way. And so those are the top two things that I could think about. And then, you know, for Fathers Incorporated, we also do a lot of fee for services. We have also a lot of contracts that we do work for. Talk to your local TANF office and specifically your child support office and see if there's some way that your agency can help them do something that they're struggling with. And even if it's just them referring people to you or getting a county grant or a state grant or a county grant, a city grant, a state grant, or a county grant. I think I said all three of those things. But make sure that you create those relationships with your local legislators because they all have discretionary funds, specifically on the TANF side and on the child support side. So make sure that you touch base and just ask the question, hey, you know, where are there funding opportunities for my agency to be able to serve the constituency of fathers in my community better?
Thank you so much for that. And there are a couple of suggestions that came through in the chat too that build on what you were saying. Somebody's saying Title V, which focuses on maternal and child health, that some states have been intentional about creating space for fathers and looking at that as a place. Others are adding things there about the communities you work in, but I appreciate the reminder you made about thinking broadly and about, even if it doesn't say fathers, fathers are part of families, fathers are part of parenting, fathers need work, fathers are, part of all of it. So we are coming up to the end of the hour. So while I want to ask so many more questions, what I think I want to do and need to do with the last couple of minutes we've got is invite everyone to share a closing thought on our panel that may have come up as you're reading through the chat or hearing each other's comments. And I think we'll go kind of in reverse order here, and we're going to do kind of a speed round of closing thoughts. And then I see you, Natea. I know we're out of time. And so I think we'll go reverse here. Marcus, if you would kick us off, we'll start with you and kind of work our way back to Kenneth and get a last thought from each of our fantastic panelists.
I'll just be short and sweet here. I appreciate you guys reaching out to me, and it was an honor to be selected for this panel. And thank you, Jeffrey, Marietta, and Mr. Braswell for your expertise.
Thank you so much. Marietta, would you like to go next?
Thank you. And thank you for the work that you do on the ground, Marcus. Thank you. I just want to say that for social policy, one size does not fit all, and that fathers are part of communities and should be included in more of our community-based structural decisions.
Thank you so much. And Jeffrey.
Yeah, just thanks to everybody doing the hard work of helping to support fathers and families wherever you are. And I hope this doesn't come across as too self-serving, but also just maybe a plea for the need for continued data on fathers. I think we know a lot about what works well, but times are always changing. There's new technologies, new environments, new politics, all kinds of things. And I think we need to continue to understand more about the lived experiences of the fathers that we're interested in helping. And so I hope that those efforts will continue.
Thank you so much. And Mr. Braswell.
For me, I'm just going to leave you with a couple of resources. I saw in the chat there are a few people talking about statewide initiatives. There are several people around the country that are doing very well in statewide initiatives. I would say, as the young folks say, Google them. Kimberly Dent in Ohio, who's doing an awesome job with the Ohio Commission for Fatherhood. David Kozar in Kentucky is doing some great work in Kentucky. There is now some ongoing state work taking place in Florida as well as Tennessee, in New York City. In where was I just at? In Omaha, Nebraska. I mean, there are local things happening, statewide things happening. And you should just Google those folks, you will find them. The other couple of things is fathersincorporated.com. That's where you can learn more about our work and what we're doing on the ground. I put a resource in the chat specifically that's designed for fathers, and that is poppauniversity.com, Poppa university.com. I would also have you look at the National Fatherhood Initiative, NFI. They have some great curriculum, some great resources. They've been around for a very long time. And then lastly, the National Responsible Fatherhood Clearinghouse at fatherhood.gov. And they also have a national call center that is attached to them specifically for fathers. And the telephone number is 1-877-4DAD-111. That is 1-877-4DAD-111. And thank you, Dr. Walsh, for inviting me to be here.
Thank you so much to all of you for joining us. And I will just say in response to folks asking in the chat, you will get sent the recording. And if you registered for this webinar, you will hear about upcoming webinars. So I can assure you of that. Huge thanks to all of our panelists. You're all fantastic and really appreciate your time. And I'm going to turn it over to Natea to close us out.
Yes, and with that, thank you so much to Dr. Tova Walsh, Kenneth Braswell, Dr. Jeffrey Brown, Dr. Moretta McDonald, and Marcus Williams for sharing their time, experience, and insight with us today on rural families and communities. As we mentioned before, we'll be posting the recording of the webinar within a day or so, and you'll receive a link to those by email if you registered. So thank you all for joining us and have a great rest of your day.